It's a Northwest News Radio weekend. IRG's Health Talk continues.
Our first guest, Dr. Anthony Yee, a specialist in foot and ankle surgery at Orthopedic Specialists of Seattle. We're talking about the ankle today, particularly, Shannon, ankle arthritis, not one that you usually think of for arthritic joints.
Yeah, Tom, it's come a long way. Now with an arthritic joint that is causing a lot of discomfort and you're losing quality of life. I mean, there's options now. One of those options is a total ankle replacement. We talk about hips and knees a lot, but now you can do a total ankle replacement and kind of enhance your quality of life. And that's what Dr. Yee is going to talk about, when to kind of consider that total ankle joint replacement.
All right, here's Shannon O'Kelly and Dr. Anthony Yee.
Dr. Yee, welcome back to Health Talk. How are you?
Doing well. Thanks so much for having me on again.
Yeah, absolutely. I'm excited to talk to you. A lot of advancements, a lot of research, a lot of technology, a lot of improvements over the last, I've been doing this physical therapy gig for about 35 years. And I think when I started physical therapy, I'm not sure I can remember that they are actually able to do much besides fuse an ankle if you had significant ankle arthritis. But now they're doing total ankles and some very new procedures with new devices and techniques, minimally invasive and all those words. We're going to talk about ankle arthritis and ankle replacement, if that's a possibility. But before we get to that topic, just bring our listeners up to speed again about Dr. Yee and your background, your interests, your fellowship trained. Tell us, our listeners, again about the day in the life of Dr. Yee, as I like to say.
So I'm an orthopedic surgeon here in Seattle. I practice at a group called Orthopedic Specialists of Seattle. We are all subspecialist trained surgeons, and we represent pretty much the entire body when it comes to orthopedics. I focus particularly on foot and ankle surgery. I love the foot and ankle. I love its diversity, and I love the fact that I get to meet so many different kinds of patients through my job, whether it's children, older patients, and everyone in between. And every activity level. So.
I when you were talking, I was just want to emphasize, when you have your health, you have everything. And particularly if you've ever stubbed your toe, sprained your ankle, fractured your foot, your foot is our foundation. And you mentioned that you just love the foot and ankle. And I'm fascinated with that part of the body also, just from a standpoint, the complexity, the nerves, the tendons, the ligaments. It's an amazing part of the body. But boy, I tell you what, when you hurt your foot and you have to walk around for your livelihood or just quality of life, you know it. Maybe talk anatomical, kind of how the foot is set up, and it's a little bit complex. Maybe talk about the complexity.
Yeah, absolutely. I think you described it very well there. It's very complex. There are 28 bones in the foot itself. So multiply that by 2. You have 2 feet, so that's a lot of bones, and those are all in a very small area, and they all have an intimate relationship to one another. And if there's an issue in one part, it can easily manifest as an issue on the other side as well. So I think there's a delicate balance. And that's part of some of the diversity and the challenges that I love to embrace on a day-to-day basis. That figuring out the puzzle and coming up with a good solution, whether that involves surgery or not. And one of those areas, I think, is ankle arthritis.
Mm-hmm.
You mentioned earlier about some of the advances, and I think that we've come a long ways in terms of ankle replacements. Sort of standing on the shoulders of giants, and our predecessors who figured out a lot of things for us. Currently we're, I would say, in a pretty good spot in which we're able to help patients immensely who have ankle arthritis.
Absolutely. The advancements in joint replacement. Even mentioning the fact that, like I said, I've been doing this 35 years. When I started, an orthopedic surgeon pretty much did everything. Now the specialization or the subspecialization in the orthopedic world, you yourself having a fellowship in foot and ankle. This is your area of specialty, and this area is complex. And you're in good hands when you're talking to someone like Dr. Yee, who's fellowship trained. We're going to take a break here, and we're going to come come back and talk about ankle arthritis and the options of ankle replacement. But before we take a break, I just want you listeners to know, now you have the answer to the trivia question out there. Yes, there is indeed 28 bones in the foot. So remember that answer. So we'll be right back.
We'll be back with more of Dr. Anthony Yee and Shannon O'Kelly's conversation next on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
Welcome back. We continue to hear from Dr. Anthony Yee and Shannon O'Kelly now.
Dr. Yee, again, thank you for joining us. Health Talk. We're talking about ankle arthritis and the possibility of having an ankle replacement. Let's talk about, I'm a patient, I've had this chronic achy pain in my ankle. What is the process and determination whether or not I'm going to progress down that road of total ankle replacement?
Yeah, so first and foremost, I think the most important part of my job is to really listen to you as the patient, where the pain is, when the pain occurs, what makes it worse, what makes it better, and what you may have tried so far. Some of those things, may include non-surgical treatment strategies, options such as modifying your activities, anti-inflammatory medications, bracing, physical therapy, injections. And if you've tried these things and we're just really not in a place where you're happy, I think that's a good time to really bring up the options of surgery.
The options of surgery today in an ankle replacement are, when you do that total ankle, let's talk about the hardware and what you're doing, because you're replacing some bony ends and some things like that in that ankle joint. Maybe talk about the replacement aspect and the surgery.
Simply put, we're replacing the portions that have worn away. So as you know, the cartilage are the shiny, smooth surfaces that allow for nice, smooth motion through the ankle. And once that's worn away, bone can start to grind on bone, and that's where a lot of that pain and stiffness come from. So when that's happened and a patient is at the point of needing an ankle replacement, what I do is I remove the portions of the bone that are basically rubbing on each other. The end of the shin bone, or the tibia, I make a cut across, and then also on the top of the talus bone, which is the bottom of the ankle joint, I also make a cut across to remove some of the bone. One really cool new technological feature that we're really taking advantage of these days is that I send a patient to get CT scan before surgery, and I work with the engineers of a company to build custom 3D printed cut guides, and these fit exactly on your specific anatomy. So I'm sure that we're making the absolute accurate cuts exactly how I want them to, and to make sure that this ankle replacement is exactly the way, the shape and position that I want it to be in.
That is amazing. So basically, it's kind of topography. You're kind of matching the topography of that end of that joint using a computer, then installing that new apparatus prosthesis exactly how it was anatomically or genetically when you were born. Is that fair to say?
Yeah, so just really trying to restore everything back. So for example, our ankles are all shaped a little differently. Some people are tipped a little bit to the out, or tipped a little bit towards the inside, or varus, and we can make adjustments for that. With this new technology, we're able to really, really fine tune and hone in the correction that we want to get with these ankle replacements.
Amazing technology, amazing advancements. Dr. Yee, we're out of time, but I do want to say thank you for your information. And man, I just find it fascinating when I have a chance to chat with folks that are doing what you do, changing lives, decreasing patients' pain, and more importantly, getting patient back to ambulation or walking and quality of life. Thank you for what you do, and thank you for coming on Health Talk.
Hey, thanks for having me, Shannon.
You bet.
You've been listening to Dr. Anthony Yee. You can go to Orthopedic Specialists of Seattle.com to get more information. Shannon, you mentioned hip and knee replacement. Now ankle replacement is an option for some people as well.
Well, they used to fuse these joints, and an ankle replacement is a lot more functional and gives the patient more mobility and more options to stay active.
Our next guest coming up after this time out on Northwest News Radio.